Hello, this is Jonathan Wright, Dr. Wright, according to the University of Michigan at Tahoma Clinic in Tukwila, Washington. Today's topic is going to be, let's not get skin cancer, okay? And that does not mean sunscreens. Good grief. Do sunscreens really prevent skin cancer? I think it was Dr. Michael Holick, who's a professor at one of the universities in Massachusetts, published a graph that showed the incidence of skin cancer and right next to it, the amount of sunscreen used. And that graph started in the 1920s. And it went on, I believe, till the 1990s, which is when I took a look at that publication. And what do you know? The level of skin cancer and sunscreen use was down here in the 1920s, and they both went up in parallel to the 1990s. Does that mean that sunscreen causes skin cancer? No. Just because they're in parallel doesn't mean it's cause and effect. But what it certainly means is it doesn't really prevent all that much skin cancer if the two rose together in parallel. Sunscreen use? It doesn't seem to be that helpful. Oh, and by the way, there's some people who have studied it who say it might be toxic. But I'm going to get off that topic because there are much better ways of preventing skin cancer, and almost all of them involve, guess what? Diets. Yes! Now, I'm relying on a publication that was in a journal called Nutrition Reviews by Dr. Niva Shapira. That was published in 2010. Could be 2009, but I think it was 2010. For a link to Dr. Shapira's article, just look below. Dr. Shapira did a wonderful job with 140-some citations going through all of the elements found in a particular diet that are known to prevent skin cancer and reduce its risk dramatically. Now, that diet happens to be the so-called Mediterranean diet, and as you'd expect, it was formerly eaten throughout the countries of the Mediterranean. It seems that people who eat the traditional Mediterranean diet have very significantly less skin cancers than people who don't. And that's even people of the same ethnic group, the same genetic background. As she points out, if you happen to be Greece and living in Greek, did I get that backwards? Yes, I did. If you happen to be Greek and living in Greece, and you're eating the traditional Mediterranean diet, which not all the junk food, your risk of skin cancer is way down here. If you happen to be Greek and you move to Australia and you take up eating the standard Australian diet, which is just as bad as the standard American diet, both of which the initials are SAD because they're very sad, your risk of skin cancer goes up like that. Diet. Now, what are the things that are eaten in that diet? Because, no, we're not going to move to the Mediterranean, but can we eat these things that help to cut the risk of skin cancer? Well, yes. For a link to the Mediterranean diet, there's another place to click below. Now, I'm going to pick on just one component of tomatoes, tomato paste, and watermelon. It's called lycopene, Lycopene. It's the red pigment. What was found in studies that Dr. Shapira cited was that it cut down on the amount of UV damage to the skin by 70 to 80%, just having lycopene in the skin. And ladies, you're going to like this one. It's a little bit off the topic, but other researchers found the more lycopene in the skin, the less rough the skin is. Now, of course, for that it would take eating 5 or 6 cans of tomato paste a day, or maybe a couple of watermelons to get that much lycopene. But even so, all of those foods help to prevent skin cancer. Oh, but what if you don't like some of them? What if you don't have the chance to eat them? Well, you might guess that after Dr. Shapira's article was published, well, I waited. I thought, for sure, some company will just put the active ingredients in all of those foods that have been shown for sure to prevent skin cancer into a supplement. And you know, nobody did. So, okay, I got on the phone and I called up one of the many supplement companies and said, would you put it together? I want you to use this, and this. And by the way, it's not original with me. I'm just a dreadfully good copycat. and I copied what Dr. Shapira wrote, and what we came up with between the vitamin company and me was a supplement called SunPal. It allows people to go out in the sun for longer before even sunburning. I'm not kidding. The first year that went on the market, of course, I tried it, and my wife tried it. And we started taking it for 2 weeks before we went to a very sunny place for vacation. And what did we find? We could be out in the sun for 2 more hours before we had to go in. Already I could be out for 4 hours before I'd start to burn a little in the strong sun. I could be out there for 6 hours. It was protecting my skin. And Holly, my wife, found the same thing. Now, she only could stand 3 or 4 hours before, and now she's up to 5 or 6 hours. So, please, the big deal is what we eat. It's not taking supplements, and I'm not here to say everybody should take this stuff. What I am here to say is, please adopt as many of the foods that are found in the Mediterranean diet, and you will cut your risk of skin cancer dramatically. You also, if you want some insurance, can get this stuff, and yes, I'm going to bring it on briefly. It happens to be called SunPal, and it tells you on the label how much to take. And if you do that, if you plan to do that, do it for a couple weeks before you go on vacation, and it'll dramatically cut your risk without the use of sunscreens. No kidding. And that's that. Hey, thank you for watching and listening. Be with you another time.